They should be getting new links sent here soon. So just tell them to refresh their emails, and they should be able to get in the meeting as speakers here in a couple of minutes.
I think I really appreciate your help.
Yeah, not a problem.
Huge.
No problem. I'll check back in to make sure everything went smoothly.
Perfect. Thank you. It's all good. I know. How many people are here for that? No, oh, yeah. It's good to take advantage of that. You were present. It's important. Oh, feel free to sit up here. So we're trying to get Belinda, Marge, and William online. We're having some trouble, but IT is working. Yeah, you're great. I'm just trying to find things here. I'll sit out there too. I know. It's weird. Plus, it's nice to see other people's presentations. Yeah. So yeah, I'll do the same. I'll sit there next to you. Robert.
Morning.
Morning. I'm just pulling up our agenda. Totally cool. Support for you. No, but so we have Ellen from the Ministry of Education, Carla from the Ministry of Water and Sanitation, Dorothy from the Ministry of Health, like trifecta, and they would like to share so maybe if you want to just moderate that and kind of wrap it up.
All right.
Yep. How'd you do that?
No.
Oh, yeah. I'm fine. I'm fine. I'm not stressed at all. Anymore. I'm so sorry. I didn't do yeah, you're all good. Charlotte. Hey, we got one person online out of 3. We've recorded together, so yeah. We had another meeting. So pull this down real quick. Yeah. No, well, kinda, actually. How do I make it? Oh, I don't know. I can't, but it's so much nicer. People hear from other people. So it was more like just, welcome. Here's kind of our overview. We're going to do all present highlights from the new report, and then we'll kind of focus in on some of the disability inclusive examples. We'll have a group discussion. It'll be brief. You don't have to participate. And then we'll do another highlight on preparedness, another group discussion, and then we'll kind of wrap up the discussion. And it'd be great if you do this one. Yeah, cool. And then you can pass it over to. Okay, thank you for doing that. You appreciate it. Okay, we'll give folks a couple more minutes to roll in. I know the first session of the morning is a little bit rough sometimes, but if you're already here, we're going to use Slido for 2 really short group discussions. They're optional, but if you'd like, you can go to slido.com and type in 6358366. We're having some issues with how Slido appears on the screen, so the QR code doesn't work, but you can go to slido.com and type in that code. Hopefully it works. It's going to be an experiment. With that, I'll pass it over to Matt Freeman from Emory, who's going to give us an overview and start the session. I think this works.
Sometimes you have to click the actual. Or not. I got it.
Yeah, cool. Thank you.
I think. Hi, good morning, everyone. Good morning. All right, so it's great to have this session to talk about the JMP's update on Washington schools. Some of us who have been doing work on Washington schools for over 15 years, it's astounding that there actually are JMP indicators now. When I started working on this, it was kind of in the wilderness, the WASH wilderness. And so it's really exciting that there's real progress being made on trying to understand the coverage of Washington schools, and this focus on preparedness and equity is crucial. So our agenda for today. Oh. Yeah. Our agenda for today. I am talking for no more than 3 minutes, and then we're going to go into Christy Chatterley describing the progress on Washington schools and the new data Then a focus on disability inclusive wash in schools. Then we'll do a group discussion that Christy assures me you do not have to participate in if you do not want. So don't run away, just hide in the corner and do your email if you don't want to participate, but we'd love for you to participate. Then focus on pandemic preparedness in schools, another short discussion, and then an overview of the Global Wash-in Schools Network, and then closing. So that's our agenda. Our two objectives, things we'd like for you to leave with. Understand the current status of wash-in schools and the progress that we need to make by 2030 to meet the SDGs. And then also exchange some practical lessons and ideas about how to further strengthen monitoring systems, including identifying key indicators for monitoring pandemic preparedness and disability inclusive wash in schools. And before I leave, I will do one quick plug, which is that I teach an online wash in schools class through Emory. It is in the spring, and it's some asynchronous learning. Christy gives a lecture, and we meet a few times over Zoom, and it's a really great experience bringing in practitioners and students from all over the world. So hit me up if you'd like to chat about that. What? Yes, I'm inviting you to take the class. That is what I'm saying. If you would like to take the class, come talk to me. Thank you for helping me translate my own words. All right, over to Christy.
Thanks, Matt. I appreciate that opening, especially with all the years that you've worked on wash-in schools. You've seen a lot of changes. See if I can move these over. Nope, that's going the other way. Okay. Man, these slides are real finicky. Okay. I have the privilege of just kind of presenting some highlights from this report. It's online at washdata.org. There's also some hard copies that are, at least were, on a table out in the lobby. So if you want a copy, you could come find Aicha or myself. Aicha also works for the JMP team on the UNICEF side, and we're happy to try and find you a hard copy. But we'll present some of the highlights from this report today. I think many of you are aware of this, but just to kind of set the stage, wash in schools is explicitly included in the Sustainable Development Goals, thanks to the hard work of some of the people that are in this room, like Matt and Robert Driebelbis. I don't know where you went, but I know he'll be back because he's closing the session. Oh, nice, you're hiding behind Matt, perfect. So they're explicitly in the SDGs under Target 4A. There's an indicator that says the proportion of schools with, there's a few other services like electricity, and the last three are basic drinking water, basic sanitation, and basic hygiene. And then there's a note in the SDG language that says, as per WASH indicator definitions, and some people ask us what this is referring to. And it refers to the definitions that you see in the top row of the table. So these are the definitions of basic service that were agreed upon by a global expert group that the JMP convened back in 2016. It included people from different sectors, education, health, water and sanitation, and people that worked in different parts of the world and that worked for government and non-government agencies. So if we look at those, the definition for basic drinking water is there's drinking water from an improved source, and it's actually available at the school at the time of the survey. For sanitation, they're improved facilities, they are single sex, and they're usable, defined by available, functional, and private. And then for basic hygiene, there are facilities for hand washing with water and soap available. Those of you that know the JMP, you know that we love service ladders. So we have service ladders for wash-in schools. These encourage progressive realization of services. So in yellow, we have limited service. This basically means there's infrastructure there, like an improved facility, but not all of the service criteria are met, like water being available from that infrastructure. And then the last row is no service, where there's no infrastructure or it's unimproved.
So the WHO UNICEF Joint Monitoring Program is responsible for monitoring WASH-related SDGs. We're the custodian agency for 6.1.1 and 6.1.2, but we also support other WASH-related targets, including 4A, where UNESCO UIS is the custodian agency. So as part of that, we develop methods for global monitoring, such as convening that expert group and coming up with these agreed upon definitions. And then we produce updated estimates every 2 years. And we do it a little bit different for institutions than for households. We also monitor healthcare facilities. So we sort of swap back and forth with the two. So this year we released a data update, a shorter report for schools and a full report for healthcare facilities. And in 2 years, that'll be flipped and there'll be a full report for schools. And then 2 years later, a short data update. For this data update, we had over 1,000 national data sources. And you can kind of see in the graph, this is increasing each time we do a report, which is great news, right? And a lot of these are coming from integrated national monitoring systems, usually the Education Management Information System, or EMIS, which is great. So I'll quickly go through some of the results. As of 2021, we estimate that 71% of schools had a basic drinking water service. If you look at the 2015 value of 70, this is not super inspiring progress. We're really kind of stagnating on improving access to basic drinking water. You see kind of a range of coverage by SDG region, which is on the left side of that bigger graph. And then in one case in Latin America and the Caribbean, we actually didn't have sufficient data to make an estimate. If we look at the country level, you see a very wide range of coverage here, but there's some countries, such as in Europe and Northern America, that have already met the SDGs for basic drinking water in schools. And then other countries, especially in the sub-Saharan Africa region on the left side, where coverage is still quite low. For sanitation, we estimate that 72% of schools had a basic sanitation service. A little bit more impressive progress than drinking water, but still kind of slow. And we'll talk more about that in a little bit. We see a range in coverage and rates of progress by SDG region as well. And at the country level, also really wide ranging, but there are a number of countries who have already met this SDG. Okay, for basic hand washing, and this is very basic, it's really just a hand washing facility with water and soap available. We estimate that just over half the schools in the world have this basic service. Not a great improvement from 2015, where it was 52%, and now in 2021, we're estimating 56%. There's a very wide range of coverage between SDG regions, some really low coverage that's a bit concerning, all the way up to full coverage in Australia and New Zealand. And an even wider range when we look at the national level, there are some countries that have below 10% of schools with just a hand washing facility and soap and water. Okay, we've been looking at national data, but as we know, there tends to be some inequalities within countries. So if we dig a little deeper and we look at disparities between rural schools and urban schools and by school level, we see that in some countries, there's not a very big difference, such as Ecuador here for urban and rural, whereas in other cases, there is a big difference. In Ecuador, secondary schools actually had lower coverage of basic hygiene service, which is kind of surprising. On average, I would say urban schools tend to have better coverage and secondary schools tend to have higher coverage than primary, which tends to have higher coverage than pre-primary. But with the focus on WASH in schools and particularly primary schools, we are seeing some countries where primary schools have much higher coverage than other school levels. Okay, let's talk about that golden ticket question. Are we going to meet the SDGs for WASH in schools? The answer is no, not at current rates. If we wanted to meet the SDG for drinking water in schools, we need a 4 times improvement in the rate of progress. If we want to meet the SDG for sanitation in schools, we need a 3 times increase in the rate of progress. And for hygiene, a 5 times increase. So we have a lot of work ahead of us still. If we look at that on the national level, and I'll zoom in on one of these are countries plotted by the rate of change on the y-axis, and then the actual proportion of schools with each service on the x-axis. And so if I zoom in, we can kind of see that for drinking water, 2 of 24 countries that have enough data that we can estimate trends are actually on track to meet the SDGs. Those are in the little blue triangle. There's a number of countries that are making progress, but it's too slow to meet the SDGs in yellow. And then there's some countries that are actually decreasing in their coverage of drinking water and sanitation and hygiene in schools. So if you want to kind of dive into the data and really get into the nitty-gritty, you can download the JMP country files at washdata.org/data/downloads. And here you can find all the data sources and assumptions that we use to come up with our estimates. So I highly recommend that if you want to kind of see what's behind these values. There's some additional resources that I'll recommend just to wrap up. That QR code will get you to the JMP website. Most of these are pretty easy to find. Some are buried. So please find iChar myself and we can help direct you to where you might be looking. But you can download the data update there. We have a methodology note explaining in a lot of detail how we came up with these values. There's also that third one is a resource to help with data collection and analysis. There's some recommended core indicators and questions, not just for basic service, but beyond. And then we newly published an Excel document that helps support that third report. So thank you so much. Again, please email us info@washdata.org if you have questions. And then we'll move on to disabilities, which unfortunately you're stuck with me again. I'm sorry. We had to flip some things around. We have folks on Zoom. So I'm going to present on this as well. And then I was thinking after William from UNICEF presents, we have a recorded video, but he is hopefully online. Then we'll take questions for all 3 presentations, if that works. Fabulous. Okay. I'm just going to kind of focus in on disability inclusive WASH in schools. So we presented the service ladders for WASH in schools earlier, and I want to highlight that we recognize basic service does not necessarily meet the human rights to water and sanitation. There are definitely elements that are missing there. We're trying to find something that was realistic to meet by 2030, and that we had validated indicators that could be harmonized across countries. But many countries have already met this level of service. So we encourage national governments to include an advanced service level depending on national priorities. And you'll notice in all of these ladders, there's accessibility to all users, and that includes disability inclusive WASH in schools. So we wanted to kind of focus in on that and highlight some country examples. So there's a thematic pullout section in the data update that kind of highlights these. And I'll zoom in on this, but this is just a table of example indicators and questions that countries are using to track or to monitor disability inclusive WASH. And you'll notice if you take a look at all these, there's a different way that people are collecting data on disability inclusive WASH, which makes it really hard to do cross-country comparison. And something that I want to flag up front as we're looking at data, we're not always comparing apples to apples. So for example, in Peru, they have a national annual survey that includes a question about if there's at least one toilet with support railing, another question on if there's a toilet where a wheelchair can go in and turn around. And then we look at a survey in Tajikistan where they asked teachers if students with disabilities could access facilities, and they asked them to kind of rank it by difficulty in accessing those services. So kind of different things that we're looking at there. And what that means is we get different levels of coverage. And I'll zoom in on these again, but these are looking at the coverage based on different indicators in and across countries. So if we kind of look at Peru and Tajikistan again, you'll see there's a slight difference depending on the question in Peru. And then in Tajikistan, we see a really big difference. 63% of schools, teachers said that toilets were accessible without difficulty. and 3% said they had separate toilets for students with disabilities. And, I don't know that we need separate toilets for students with disabilities, so it's an interesting indicator. And William from UNICEF will kind of talk about this a little bit more. What do we mean by disability inclusive? What's important? What should we be monitoring? And then we'll talk about that in the group discussion. So I'll run through some examples where we do already have data. If we look at the proportion of schools in different countries that have any toilet, that's in the light green. And then we look at the proportion of schools that have a disability accessible toilet. Regardless of the different definitions used within these countries, we're seeing a really big drop when we look at inclusivity for children with disabilities. Costa Rica has actually been collecting data on disability accessible toilets since 2014 in their national survey. And so that allows us to track progress towards improving this service. And we see improvement in all 3 school levels. For that question in Tajikistan about the level of difficulty for students to access services, as an example, we see that in about 1/3 of schools in rural areas, teachers reported that students had difficulties accessing WASH services. And then something kind of interesting, we wanted to dive a little deeper into that because there were a lot of different questions in this survey. If we look at hand washing facilities, 54% of schools had a clear path. There's no obstructions. 17% had tap and soap that are reachable from a seated position, and 9%, nope, that's an 8. 8% have a tap that can be operated with a closed fist. So these are indicators that we commonly see based on normative definitions of disability accessible services. But when we compare that to something like, do your students, can they access facilities without difficulties? We're seeing really different numbers. And then we kind of lastly took a look at what the coverage was like in different school levels. Saw some interesting patterns where sometimes pre-primary schools have lower coverage, such as hygiene in Syria. Sometimes it's higher, such as hygiene in Solomon Islands. So that's kind of interesting. Okay, here are a few more resources. I mostly want to highlight that document in the middle. It's William, who we have a video from, and I believe he is, yes, he's now online on Zoom for questions. He's going to refer to that document. So you have that and you can download it. Just kind of Google Make It Count and you should see that. Okay, last and best presentation, and then we'll take some questions.
Hi, my name is William Bermond. I work for UNICEF headquarters as Disability Inclusive WASH consultant. This presentation, what is Disability Inclusive WASH in school, will give you some key recommendations and tips to make sure that your WASH in school project is disability inclusive. So the Disability Inclusive WASH in school key recommendations are the same key recommendations for any Disability Inclusive WASH project. Meaningful participation and continuous consultation of children with disabilities and adults with disabilities, referring to the staff of the school. Identification and addressing barriers that the children with disabilities and the adults with disabilities are facing in the school to access WASH, referring to WASH facilities, hygiene messaging, hygiene kits. Empowerment and reinforcement of the capacities of the school in terms of what? In terms of WASH, of course, in terms of understanding disability, and in terms of prevention of WASH-related diseases. And as well, we have to make sure that disability data are properly collected, monitored, and reported. So if we talk about disability inclusive WASH in school, we have to talk about accessibility of WASH in schools. Okay, in the WASH sector, accessibility concerns the hardware and the software component of the sector. And as well, if we talk about accessibility of WASH in school, we have to make sure that the school and its building are accessible. But what is accessibility? So accessibility, according to the Convention on the Right of the Persons with Disabilities, accessibility affirms the right of persons with disabilities to enjoy access on an equal basis with others to the physical environment, to transportation, to information and communications, to other facilities and services. And if we talk about accessibility, we have to talk about accessibility continuum. What is it? This is the experience of everyone in the school, including children and adults with disabilities, leaving the classroom, using the pathway, as you can see on the sketch, to reach, enter, circulate, and use the WASH facility. So we talk about the unbroken chain of movement from the classroom to the WASH facility. This is the RICU approach, standing for reaching, entering, circulating, and using. So for example, if in one school you have constructed a very nice latrine block for the pupils and another one for the staff, but then you realize that the pathway from the classroom to the facility is in very bad state, a lot of stones, slope, slippery, then you can imagine that children using a wheelchair or children with visual impairment, for example, cannot reach the facility. Okay, so make sure that the accessibility continuum is applied and respected. And if we talk about accessibility, we have to talk about design. We'll talk about universal design and reasonable accommodation. So first example, you are going to a school and there are no WASH facilities, or the one existing are in a very bad state, you cannot use it. So you destroy everything and you decide that you will build new WASH facilities. So in this case, you will apply the universal design approach. What is it? This is the design of your WASH facility, okay, to be usable by all people to the greatest possible extent without needing adaptation or specialized design. Then what about reasonable accommodation? So imagine you are going to another school. There are some latrine blocks, for example, okay, in good state, okay, but they are not accessible, meaning that girls with visual impairment, they cannot use it. So maybe here you will add a ramp, you will add some handrail, okay, you will add you will do some adjustment to make sure that your facility is accessible. So this is reasonable accommodation. In this case, you are providing reasonable accommodation to existing WASH facility. So this is about necessary and appropriate modification and adjustment, and you are not imposing a disproportionate or undue burden, and your WASH facility become accessible. So we have this drawing, okay, illustrating what I just said before. Okay, so let's imagine a baseball field and you have a wooden fence all around. And in the public, you have different people, different size, different gender, different disability. Okay, and with the traditional design at the entrance of the stadium, we provide the people with the same box. And you realize at the end that it's not really convenient for everyone. The smallest person cannot watch the game. So you decide to provide some reasonable accommodation, meaning that you take into consideration the specific need of everyone and you provide a specific response to this need. So in this case, we have given 2 boxes to the smallest person for him or for her to watch the game. And to the tallest person, we didn't give him or her anything because he or she doesn't need it. And in the last image, you see that we have decided to remove the wooden fence and to replace it with a wire fence. In this case, everyone can enjoy the game. Then what about disability data collection, monitoring, and reporting? So here, I provide you a list of disability inclusive WASH in school indicators extracted from the UNICEF guidance Make It Count. Okay, so this is quantitative indicators to help you to measure the impact of your WASH project on the children with disabilities and the staff of the school. So these are quantitative indicators that you can complement with some qualitative indicators to measure, for example, the level of satisfaction of the users, their level of participation throughout the project. Then how do you track and measure this indicator? So different tools that I'm presenting to you. First, the Washington Group question. This set of questions will help you to identify the person with disabilities, their disability, and the severity of their disability. Then, thanks to this question, you will be able to identify the barriers that these people might face to access WASH. So we have different set of questions. Okay, the one for adults, okay, with 6 questions on functioning in core domains: vision, hearing, mobility, cognition, self-care, and communication. Okay, 6 questions. And to this question, the interviewed can answer, okay, using a scale from no difficulty to cannot do at all. Okay, so here I present you one example of question regarding visual impairment, and you can see that the interviewed people can answer no difficulty, some difficulty, a lot of difficulty, and cannot do at all. And you have as well another set of questions designed for children. Okay, so one set of questions for children aged between 2 and 4 years old, and another one for children between 5 and 17. Then another useful tool to track your indicators is the safety and accessibility audit. Some checklists, very easy checklist following the RICU approach, which will help you to check whether or not the wash facilities are accessible or not. Okay, so checklist that you can fill, okay, based on observation, and you can easily use this audit when you're doing your need assessment to check whether or not the wash facilities are accessible and safe, and what kind of adjustment you will have to do. Okay, and you can use the same audit as well at the end of the project to check whether or not your wash facilities are accessible. And then you can use all the tools that you know already to track your indicators, the CAP survey, the school survey, and the classical program monitoring. So before concluding this presentation, okay, I will just present you 2 good practices on disability inclusive wash in school. First in Togo, where UNICEF with the government of Togo and the Ministry of Education have invested in inclusive wash in institutions like school, health center, and as well in communities with an inclusive CLTS approach. So all started with a participatory assessment of girls, children, and persons with disabilities toilet use. And thanks to the findings of this assessment, the Ministry of Education was able to develop standards for washing school, including the specific needs of persons with disabilities, and they have as well designed indicators to measure the impact. And then another good practice in India, where UNICEF, Government of India, and the Ministry of Education of India have developed a booklet on school sanitation and hygiene education with norms, design, and a lot of tips and recommendations to implement wash in school. And as you can see on the screen, with some detailed technical drawing of universal design of latrines, water point, hand washing facilities, bathing facilities. Okay, so now in India, for any wash in school project, you will have to respect these norms and designs. So I hope this presentation has been useful for you. And if you want to reach me, do not hesitate for additional information, and enjoy your conference. Bye.
Great. Thank you, William. William's online on Zoom as well, so we could take some questions for any of the first 3 presentations, and I'll try and pull him up here. But if you have a question, feel free to say it really loudly, or you can grab the microphone there in the middle.
I was just wondering if you are ever able to offer guidance on phrasing of questions or any questions, or is there ever a back and forth, or do you just think?
Yeah, that's a really good question. So we do have a lot of country engagement where, we have our core questions and indicators document with recommended phrasing. They've been reviewed by the global expert group, but they're not always perfectly aligned with what countries want to monitor. So sometimes there's back and forth where countries will say, here's what we came up with based on national priorities and the phrasing in this word, or the phrasing in your report. What do you think? And so we'll kind of have some back and forth to make sure that we can track the SDGs and they're monitoring what they feel is important in their country. Does that answer your question, Sarah?
Yeah.
Okay.
You have a hard job.
Matt? Yeah, that would be great. I should have repeated your question. That I forgot that mic is linked. William, I'm trying to pull you up.
William, this is Matt Freeman from Emory University. My question was about how do you communicate or about the different kinds of disabilities? Because at Christie, I saw it's quite variable as to even the consideration, and there's pictures of wheelchairs, but that's obviously only one kind of disability and that's only physical disability. So how do you communicate that to the countries, and how do you communicate that within these guidance documents about the myriad types of disabilities that should be addressed?
Hi, can you hear me?
Oh, yeah, we can.
Oh, hello. I didn't hear all properly the question, sorry. It was cut.
Here, Matt's going to come up to the front microphone because maybe we're having trouble with that one, just to make sure.
Sorry for
that. Sorry. So my questions was about the different kinds of disability that are out there and how you communicate. We know there are myriad types of disability, yet we are trying to distill these into very there's limited communication, I guess, with countries. And how do you communicate? How do you communicate the myriad types of disability, and how do you accommodate the myriad types of disability within this document? So both how do you communicate it, but how do you accommodate it within the specific guidelines? You showed a picture of a child with a wheelchair, but that's typically thought of as the disability, but there are many kinds of physical and non-physical disability.
Okay, thanks for the question. So if I get it right, I will answer to you in the frame of any Washington School project, no? So the very first stage of any disability inclusive Washington School project, and even any disability inclusive WASH project, is to identify the person with disabilities and different type of disabilities. So that's why in this presentation, I showed you the Washington Group question, which is the preferred tool to identify person with disabilities, the type of disability, and its severity. And I do agree with you that when we talk about in WASH sector, when we talk about a person with disabilities, people used to think only about physical disability. And when we think about universal design or disability inclusive WASH facility design, we think only about a physical, let's say, visible disabilities. So the recommendation is to, in the very first stage, not to assume the type of disability we're going to have in one school, but to do this proper assessment using the Washington Group question to identify the wide range of disability that we have inside the school, okay, and what kind of specific response we can provide to any disability. So it's something that has to be done in the early stage of the project. And then you were asking, if I'm not mistaken, how do we communicate with the country? So the recommendation for any disability inclusive program is that you do a project to accommodate the needs of the person with disabilities, children, adults, or whoever, but in the same time as well, you have to work, your organization or your colleagues or other organizations, you have to work with the country to make sure that within their policies, within their norms, they take into consideration the needs, the specific needs of any kind of disabilities. So these go through, of course, education, awareness, because, I mean, not everyone know well the different kind of disabilities and stuff like this. And the common mistake is that to focus only on visible disabilities. So two axes, no? So on one side, you will do your project accommodating the specific needs of any kind of disabilities. And on the other hand, you will work on awareness, education of the concerned institutions, ministry, to educate them, no? And to know, for them to understand what is a disability, what are the different kinds of disability, and what are the specific needs for each of them. So I hope I answer your question. I can speak more if you wish. When I start, I cannot stop.
Yeah, I think you got a thumbs up, William. Thank you so much.
All right.
Appreciate it. There's a question through the Slido poll as well from Brandy. It says you highlighted that some countries have decreased their WASH services. Is that largely due to population growth or existing services lacking functionality? And, you know, Aicha, feel free to chime in here. I'd say it's a combination and really depends on the country. In some cases, there's internal conflict and we're seeing decreases or gaps in data. In other cases, there's really high population growth, and there's a figure in the report that actually tracks by school age population. So you see there is a higher number of students without access to services in sub-Saharan Africa, whereas the actual number of students is decreasing in some other regions. Yeah, cool. Thank you. Maybe one more question and then we'll switch.
David Berendes from CDC. Just a question on maybe the data you presented, and I'm wondering if you've looked across the different, I know you present by the water ladder and the hygiene ladder and things, but across them, for example, the number of schools where the hygiene issue is really water access, and so it's really a water issue. Do you have those cross analyses in the report?
That's a great question. Thank you for asking that. Do we have cross analyses between the services? So is the hand washing issue really about lack of water, or is it lack of soap? Normally when we do a full report, yes. And so our last full report that Aicha has a copy of, it has a blue cover that's available online. I just can hold it up. That kind of dives into that a bit more. And then in the country files, you can see the proportion that didn't have water, didn't have soap, or didn't have a facility. So that's a great question. Maybe I'll pass it along to John Brogan from Helvetis for our optional but recommended group activity. Thanks, John.
Sure. Morning, everyone. Well, let's get into this. William has just presented some definitions for disability inclusive wash in schools. And our question is, what do we need to be monitoring on this? What should we be monitoring at the school level, maybe at the local level, at the national level? So we invite you to get into groups of 2 or 3 persons and discuss this. We have a Slido poll, which okay, great. So we have a Slido poll. It's not showing very well, but again, based on what William has shared, what we've taken in today about the definition of disability inclusive wash in schools, what should we be monitoring? You know, get with your neighbor, 2 or 3 people together, have a discussion about this. If one person would like to fill out the poll, that'd be great. Yeah, let's see what comes up from this.
Number to log in with Slido, it's not showing up. If you go to slido.com, the number is
The number of Slido is 635-8366. Those online, you can also contribute your reflections on what to monitor. You can use this Slido. Sure. Now it's good. No one's Okay.
know if it'll refresh. But if we see stuff there and we can't read it, we can always go to the next one.
Okay.
I'm gonna see if we're on time. See how we're doing.
Just take a couple more minutes and maybe come up with a few different examples you'd like to share.
Fix that and hand over to Aisha at 9:20.
Okay. I might just grab the mic and run it. Yeah. We've had a couple of responses from online. So one is the acceptability of WASH interventions according to the children with disabilities. Attendance and increase in enrollment, imagining that that's children with disabilities. Good one on this. Oh. Can you scroll back? So monitoring this chain from the classroom to the point of use. So this is, they can reach it, they can enter, they can circulate within, they can use it. Would anyone like to share what they've been discussing? Who's got some good ideas? You haven't been able to get it up on Slido yet. You'd like to present it here? Yeah.
Vincent from University of the Philippines, Manila. I was the first one who answered acceptability, now coming from the point of view of the end user, and that is the school child or the school children with disability. And of course, qualitative means you gather information, and it could be split into a number of items: ease of use, access, etc., uninterrupted access, etc. So this will involve a bit of social science, I think, no, to get the points of view of the school children with disability.
Thank you very much. How is it in their experience? How are they experiencing these inclusive measures that have been taken? One or two more? Yeah? Anything coming up online? Communication with special education units needs to happen to establish this monitoring process. Meaningful participation of all people, so universal design where people living with disabilities, they can contribute and solve the problems. Mainstreaming disability within Washington schools. Anything else coming up, Christy?
I think you're hitting all the highlights here. Does anyone feel like they have anything else they want to share on this? There's some really good discussion.
Yes.
Oh, I think.
Hi, I'm Carolyn from the EPA, U.S. Environmental Protection Agency. And when we were discussing mainly a lot of the challenges with monitoring this type of social dynamic. But one thing that caught my eye with the presentation of the two different countries and how they ask the questions, it's challenging when a question is asked that is based on opinion, like how difficult is it for an individual to use the facilities, whereas the other question had, you know, markable check boxes that you could say there are handrails and this and that. I don't know, more of just like a thought-provoking part of the presentation.
Yes, this combination between what we can really observe and is quite check boxes and what is the qualitative approach. Great. Any others? Great. Well, thanks for
Apparently that's the end.
Now we have a new show.
Okay. No. Al? Save us, please. Thank you. I don't know what's happening.
How do you kind of disaggregate or separate the provision of services? So I can imagine a situation where you could provide all of these facilities, but then how do you understand if those facilities actually get used? And then how do you keep that data out? Especially if I'm a disabled person and I've never had the opportunity to use the facility, would I be encouraged to use it once it's there?
Thank you. William, if you can hear us, do you want to reflect back on any of these contributions or respond to that? That's an if, I know.
Which contribution? There were many.
Yes, we can hear you. Please go ahead, William.
Now I was asking you to which contribution, because there were many.
Any that have really impressed you, something you'd like to speak on? What was just said, the one that was just said as well?
Let me emphasize something that I was presenting in a presentation regarding the checklist and stuff like this. I think it was mentioned by the audience, and actually a good way, I think, to make sure that the disability inclusive, the Washington School is disability inclusive. I was presenting you this checklist, which is used. Okay, and thanks to this checklist, you will be able to check whether or not the facility is accessible. So it's just simple question that anyone can use, whether or not you are a WASH specialist, whether or not you are inclusion specialist. It's just simple checklist based on observation, and just go around the school from the classroom to the WASH facilities, and you just check if it is if you can reach the facility, if you have a wheelchair, or if you have visual impairment, whatever. Okay, so this I really recommend to check whether or not your WASH facilities are accessible, to check everything from the classroom to the facility itself. Okay, and using this checklist, you will be able to see if it is accessible or not, and which action to be taken as well. I don't know if I answered the question, but somebody was talking about the checklist and stuff like this. So
yeah, that's great. Thanks for revisiting that, William. That's really helpful. We have one last intervention from colleagues in Ghana.
Thank you. So in Ghana, the Ministry of Education is actively promoting inclusive education. And for that reason, we cater for learners with disabilities in every aspect of our education. So integrating inclusive education into Washington schools is very critical, because if the facilities are not accessible, especially for girls menstruating, it will even be difficult for them to access schools during their menstruation. In Ghana, the children with disabilities are referred to as learners with special needs. So we are actively promoting inclusive education. Thank you.
Thank you very much for that contribution. I'd just like to point out that the colleagues from Ghana, you have a representative from the Ministry of Education, the Ministry of Water and Sanitation, and the Ministry of Health here sitting side by side with us today. Thank you so much. And with that, I hand back to Christy, or no, we're going to Aisha. Okay.
Yeah, thank you so much, John. Aicha Donmez works for the UNICEF side of JMP, and she led the data analysis for the thematic pullout for pandemic preparedness and response. So she'll present on that for us.
Thank you, Christy. Before I present, I would like to thank our technical support here. Yeah. Actually, it is it is an obvious thing, but it is also quite interesting. Maybe I can start to talk, right? Because for this section, normally you always give a background information to set the scene for the audience, right? When you start a presentation, but for this one, I should say, unfortunately, we all have been experiencing this pandemic, and actually still in our lives. Globally, everybody has been already affected. So I think I don't need to set the scene for you. You already know.
Let me sure. Is this your PowerPoint?
Yes. And I give it out. Okay. So it has been a horrible experience for all of us, but I want to look from the good out of this horrible experience. Let me put it this way. I think it triggered a lot of attention on the need for improvement, right? And when it comes to WASH, especially, I think there's been a lot going on. And all in all settings, not only households, healthcare facilities, especially in schools, because there has been a great, very bad disruption on education sector. So as JMP, we tried to cover this topic already in our previous update, which was in 2020. There we published a report, which is there and online available. The focus was on COVID-19. And one of the notes I can mention here is infection prevention and control, IPC, needs to extend beyond the provision of basic WASH services, while including additional measures related to hygiene, cleaning, disinfection, and waste management. So in this update, this recent update in 2022, we try to list some of those reflections by highlighting mainly the examples of emerging data, national data, which go beyond, and I'll try to show you, which go beyond the basic services. And we try to provide additional insights into specific challenges. I think the specific challenge, when I say it's the data availability, right? There has been a lot of disruption, data collection kind of disruptions. When we have even the data, we have seen that many schools already met some of the criteria for basic WASH services. But when we look all of them all together, which we call it basic WASH, when you have all of those basic drinking water, basic sanitation, basic hygiene services well set, we have seen that still the proportions are so small. And if you look at one of the bottom one, Nigeria, for instance, here, 1/3 of the schools had basic drinking water, basic sanitation services, 10th has basic hygiene, but none has actually all of them all together. Data availability was an issue, yes, but there has been rapid assessments, which kind of a relief for us to receive actually more detailed data in some countries, and Ecuador is one of them. They conducted this rapid assessment in 2020, and we had a really detailed data on group and individual hand washing facilities. In this figure, you will see first 3 columns is actually showing Ecuador where it stands among other Latin American and Caribbean countries. But from the 4th column on, you see some subnational and detailed data. And you see first at province level, although there is not that much difference between rural and urban, at province level, there's a high distribution. And when we concentrate on the individual versus group hand washing facilities, they collected actually the data on the condition of the facilities, as well as the availability of soap and water. Someone was asking, so we check actually those specific components. And as you can see at the end of the figure, actually, when we look at the situation for especially hand washing facilities with soap and water available in good condition, the proportions are quite low. And one of the comments was in the disability one. I think we should progress the change in time, especially for getting prepared for the pandemic. I think this is important, and we have seen some cases that we could manage to compile this time series type of data. One of them here is Cambodia. They added in their EMS questionnaire some questions on the hand washing facilities. And it is again a detailed data. As you can see, we get some information at provinces level. And in 1 year event, 2020 is the light purple one, and darker one is 2021. You see that there's a, I mean, I should say big change, but if you think about 1 year, I think it is kind of a big change, which we still need to do a lot. One thing to maybe underline is the baseline moved up. So the situation is better at least than before, much better than before. Another one, which is nice, I think I wanted to highlight, is from Philippines. They use 3-star approach, and they have a longer time series where we see information from 2017 to 2020. And they not only collected data on the availability of hand washing facilities, but where it stands, if it is close to the toilets, if it is close to the canteen. And for this one, you see that there's a rapid increase actually from 2017 to 2020. And especially in secondary schools, we have a higher jump. I mean, there are more to say, but I'll just, because I have other examples that I want to highlight. Some other interesting data is coming about the behavior, hand washing behavior. And in Iran, there has been a survey where they were checking if children are washing their hands before eating or if they are washing their hands after using bathroom. So we have seen that, I mean, you see the results here, 86% of the students are washing their hands after bathroom. I should, by the way, inform you that these data collection activities are different in a way that sometimes teachers are inserting this data. Sometimes school managers are inserting this data. So there's always kind of a bias which can be in the direction of overestimation or even underestimation, depending on the reason, right? If you want to attract some, let's say, budgets for the school, maybe they're thinking, okay, I should report it in a bad way so that I can get more, or they don't want to look bad. They report always, we are really good at this. So these are the general problems we have. I should maybe mention about that. Cleaning, as I said, from the previous report we were talking about, cleaning is one of the important, I think, aspects that we should start to think about how schools are really working on cleaning. And there's, as actually you see on the y-axis, there are these countries collected such information on cleaning of toilets. Again, we have this problem of harmonized questions, right? We don't have the exact same question coming from one country, but here with this list of countries, we were at least able to kind of combine some of the answers, you know, making them exactly the same. And we grouped them as, I think we did clean at least once a day, clean at least once a week type of calculations we added there. But we also have the basic information if the any toilet exists or if the toilet is clean. So this type of information came from these countries. And again, it's very interesting. Serbia, for instance, run the survey, and you can see that 100%, they have 100% in schools, they have toilet. And around, I think 96% cleans these toilets at least once a day. But when they were asked to report the condition of the cleanness of the toilets, you can see that around 90% are clean. So at least once a day cleaning, but still there's something. But more, I think, striking one may be state of Palestine. Again, almost 100%, you see toilets exist. They are cleaned at least once a day, but around 40 are clean. So there's something going on. Maybe there's some work needs to be done to dig a bit more to understand what is really happening. And another one is the waste management. And this is, I think, the last one, hopefully. I'm taking so much time, I know. So many figures. So in countries with data on solid waste management, we have seen that many schools lack actually proper systems for safe management of these wastes. And again, one example here is Uzbekistan, for instance. We are so in love with our color palettes. So for us, if you know JMP well, you will always see these colors. Waste management one is coming from the actually healthcare facilities reports. So yellow and yellowish colors, orangey colors are bad for us, but the rest of the colors are good for us. So here, red is showing actually the type of waste is collected by disposal systems. So it's a good example. In Uzbekistan, we see the situation is good. If you move to Guinea-Bissau, we see that, for instance, 90% of the waste actually is burned. They were burned on premises, which is not the ideal way of dealing waste management. So this slide means that I should stop, but we have more details in the report, as we said. We would really highly appreciate if you can go through, but I'll try to, reply, but maybe we can go through the Cambodia presentation right now, right? Maybe we'll take the questions later because there's one presentation from Cambodia office. And
ladies, gentlemen, honorable guests, and all participants. I'll start off with an overview of the COVID-19 situation in Cambodia. Similar to many countries across the globe, schools were closed for a certain period of time. This resulted in disruption to learners in all schools, from preschool all the way to university, with an estimated 3.8 million students affected. Acknowledging the adverse impact of extended school closure, including the increased risk of dropout among learners, the Ministry of Education, Youth and Sport worked grappling with how to reopen school as soon and as safely as possible after a prolonged closure. What we needed was a way to rapidly identify and level up the school whose access to wash services does not yet meet national standard. Not saying this, the school health department then proposed the use of data from the wing minimum requirements. Since 2018, the wing minimum requirement guideline has been applied to systematically collect data from schools and monitor compliance with national wing standard using a star rating system known as the C-star approach. After data was gathered, analyzed, and presented, the Cambodian Ministry of Economy and Finance and some private sector released special funding to support the construction of wash infrastructure, including toilets and hand washing facility for the zero-star school and other limited wash infrastructure. Other development partners, such as Germany Federal Ministry of Economy, Cooperation and Development, BMZ, also provide financial support to Provincial Office of Education in 5 provinces to support one-star school in upgrading their hand washing facility. In order to sustain the momentum gained from the pandemic, we plan to review the wing minimum requirement guideline and make the necessary upgrades based on the experiences and to adapt the dynamic context. We shall also continue encouraging all schools to conduct the annual assessment and submit their data to further improve the quality of the overall data set. Finally, the pandemic has provided the impetus for the use of e-learning as delivery mode for capacity building on different school health-related areas, such as WING's minimum requirement guideline, infection prevention and control, and so on. Therefore, we will continue to develop and promote online course among the education workforce to help school build resilience against future pandemics and to keep school going. Thank you very much.
We have one more actually to go. I'll ask Christy's technical support. Oh my God.
One more time. There we go.
Oh,
great. So Dr. Kuntiara, it's really late at night for him, so he won't be joining for Q&A, but we do have representatives from the Global Wash in Schools Network. So I just want to see if Belinda or Marge can hear us. And if you want to open your microphone and kind of walk us through the slide that's on the screen to provide a couple more examples from other countries.
Oh, hello.
Hey, we can hear you great, Belinda.
Great. Thank you so much, and really enjoying the conversations. Yeah, so on behalf of the Wash in Schools Network, I'm not sure if Marge is on as well. Marge, are you on?
Yes, Belinda, I'm here and can hear you very well.
Okay, great. So I'm just going to give a quick overview on the Wash in Focus document, and then after that, if you want to say a few words on the WINS Network quickly.
All right, please go
Great.
ahead.
Okay, so just to share with you, we've gone through quite a lot of interesting discussions here, and want to share a little bit of the work that we did with the WINS Network on WINS in Focus. Actually, it's a document that we put together. I think oftentimes when we see the situation of WASH in schools, I mean, we know we are not there yet to reach the SDGs, but we do see small incremental changes, which are especially in the system strengthening area, in terms of the capacity building areas, policy areas, we see huge improvements. And I kind of akin it to a child growing. You don't see, a child overnight growing. Suddenly you turn around and you have your 18-year-old who's taller than you. It's incremental. And I do think that the advances that WASH in schools are also incremental. And what we did with this WINS Network the publication was to kind of use the lens of the EE matrix, which is again similar to the SWA building blocks, looking at it through policy, looking at it through budget, expenditure, monitoring, evaluation, and we see so many advances that countries are making. So if you've got your phone handy, you can download the document, and it really does show some positive momentum, really systems that are being built and strengthened for long-term WASH in schools, and we see this very, very positive. With that, I hand it over to you, Marge.
Thank you so much, Belinda. And yeah, I'd just like to take this opportunity to briefly introduce the Global Wash in Schools Network. So this is an informal network that aims to bring together different organizations that are working on different streams, working streams in WASH, for example, capacity building, policy planning and development. And I'd like to enjoin everyone to please have a look at the WASH in Schools Network website. That's winsnetwork.org. Again, that's winsnetwork.org, where we provide or you'll be able to find out more about the WASH in Schools Network, as well as see different resources on WINS, also past events, and there are global guidance documents, country level guidelines, and peer-reviewed journals on WINS, which you can refer to. And yeah, we also invite everyone to become a member. And as a member, there's no hard obligation other than, well, of course, everyone's most welcome to become an active member, but as a member, the most basic requirement, the most basic service you'll be able to, the most basic privilege you'll be able to enjoy is we'll be able to send you frequent updates on regular updates on what events or publications are out on WASH in Schools. So I stop there, and should there be any questions, Belinda and I will be happy to respond. Thank you.
Thank you, Marge and Belinda. So at this point, we can take questions from what Aicha presented from the JMP report. Belinda or Marge might be able to answer some questions that you have from the Cambodia presentation from Dr. Kuntiarat, and then anything on the WINS network as well. So we could take those questions at this time. Yeah, Charlotte.
Sorry, is it possible to get the microphone?
Yeah, yep. I just bringing it over to Charlotte right now. Thanks, Belinda. It's on operation and maintenance of facilities. So Belinda and Marge, this might be a great one for you too.
Yeah. So we provide facilities. It's gender conscious, disability friendly, and all that we provide for the schools. Yet, if you look at the arrangement for operation and maintenance, especially when we do not have a permanent janitors at the school, support the children to clean, and how children break things easily. So the facility that's designed for a lifetime, within less than half of the design life of the facility is broken down. So when you pick the indicators or when you did assessment today, they have facilities, but you do assessment in the next year and they are without facility because the system is broken down, there's no O&M and it's not functioning. So there's a facility at the school, yet the facility cannot be used. Thank you.
Thank you, Charlotte. Belinda, could you hear that okay?
Yeah, I did. And thank you for sharing that. And obviously for all who are in the room, and thank you, Charlotte. This is a very common issue, the question around operation and maintenance. And I think to step back a little bit and look at it, the WINS Network, we are looking at it through a systems approach. So when you see a situation that a school has poor operation maintenance, it often is not just an isolated event. It's often linked to the policies, the budget, the whole monitoring evaluation framework. Our information is collected. Is it going to district level? Is it being put in planning processes? How is it being allocated? And so one of the things we do see is countries who are investing in a more systems approach to deal with WASH in schools and not just looking at it from just the O&M, but looking at O&M broader, are actually addressing this. And there will be a recent study that we've done on the 3-star approach where we looked at a number of countries. I think even Ghana is included in this. And when we see actually countries that invest in all of those 5 areas have better operation and maintenance situations. I'm not saying it's perfect, but it's definitely a start to have a more holistic system strength in building the system in the long run is really what will address monitoring evaluation. So that's kind of my response to it, Charlotte, but it's no easy answer. Thank you.
Did we have any other questions from the live audience? We have a couple on Slido. Great.
Hi, my question's for Aicha. Aicha, can you hear me? Okay. My question is, well, I was really pleased to see that breakdown of condition in Ecuador that you showed. And I wanted to ask if you have any thoughts about how that kind of data could be encouraged to be collected in other countries, because, you know, I know it's incremental, a little bit like what Belinda just mentioned, but the slide that you showed after, the case that you showed right after was in Cambodia that showed a pretty high proportion of access to group hand washing facilities. And it looks good, but I think it is one of those situations where the not quite sufficient data might actually put us in the wrong direction, because we know that the vast majority of those stations are completely non-functional. And when I say we know, I mean, I've spent those 2 years in Cambodia that you mentioned and visited many of them. And so it's so important for us to be able to say, I don't know, in the absence of that data, perhaps, how can we express the skepticism about what it really means, you know, if we show the presence of the facility, but it's non-functional.
No, it's a very good question. I think what we are trying to do is exactly that. In these reports, through these reports, we are trying to highlight these cases. I mean, Christy already mentioned, we are not at all defending basic is enough. We want to move forward, but especially in schools, I mean, households, we moved a lot, right? That's why we now have this definition of safely managed drinking water services. What we are trying to do with these short or long reports, actually to highlight these cases, showing that actually we need to dig more, we need to understand what is behind, so that anybody can see, as you already quote very well, there are other stories behind, not just existence of a toilet is enough. But again, there's still so limited data. We need to promote it, I think, we can promote it at various levels. I mean, we are working with country offices, we are working with regional offices. We always have this promotion type of, connections with them, trying to make them, work with countries closer. And we are involved in those, as Christy mentioned. Whenever they plan a survey, we are trying to be involved so that we can add more on the details. But still, it's a long path, I believe. This is, as a statistician, this is how I see it could be done, at least showing the best cases where they collect this detailed data and where we can show what is really happening, and expect that there will be some interest from other countries to dig more. But again, there are also additional work needs to be done on the data quality. So it's not the type of work is too broad. I mean, it's not just the formulation of questions, how you collect them, how you build the capacity in the countries, how you build the capacity in the schools, Ministry of Education. It's a huge work. But yes, I mean, this is one way, I think, what we are trying to do.
Thank you. I wish to add that as much as we support the provision of wash facilities for the schools, many a times when the community, the households don't have, they use that of the school. So there should also be measures in place to ensure that the households also own their facilities, so that what has been provided for the schools should be put to its use and enable the children access the facilities. Thank you.
Totally agree. I mean, as JMP, we are dealing with 3 settings. As you know, schools is only one of them, healthcare facilities and households. And actually, we are currently working on the updates of the household data. It's kind of more detailed, right? I mean, because household surveys are more structured, national, censuses are another tool for us to collect that type of data. And on top, there are many other, detailed questionnaires around. So at household level, definitely we may dig more. But again, when it comes to at the household level, we know what type of facilities they have, if it is, managed well, disposed well. So we have that type of data, but still, I'm not defending, we have everything. I'm just telling we need to do more, but we also need to set some standards to move ahead, right? This is what we are doing, basically. There is one question which I lost now.
Yeah, we have a question on Slido, and I did see some questions for William as well, and I know he had to run to another meeting. So any of you that have questions for William, either joining us online or in person, I just wanted to go back to his email real quick. Sorry, I don't know how to not play the video, but WBERBON@unicef.org. So I'd highly recommend reaching out to him directly.
Sorry. Yeah, my name is Bisia Guremi. I work for UNICEF as well. And I'm the Global World Disability Focal Point. So if you have the questions, definitely let's have the questions. I can probably attempt to answer the questions since William is not online.
Stacey, I didn't realize you were here in person. Thank you so much. I just emailed you and William about this. So that's wonderful. Yeah, please come find him after the session, and that would be wonderful if you can answer questions as well. If there are no other questions, we wanted to hand over to Robert Driebelbis from London School of Hygiene and Tropical Medicine, who's going to wrap things up. We were going to do another group activity, but we really want to leave some time for a good closing and to hear from our colleagues from Ghana as well.
Thanks everyone, and I think thanks for coming to a session about Washington schools. As Matt was saying in the beginning, this has been quite a change that we've seen historically. As Christy showed, we now have more data than ever before about Washington schools at the global level. But with this data, it is also kind of a necessary call to arms for all of us that we really need to be doing more when we look at these kind of progress levels. We were able to kind of move beyond that a little bit, start looking at to some of more of these advanced indicators. What does this mean, not just for presence of services, but for the needs of students with disabilities? How does this work on IPC and infection prevention and control? And a really great example from Cambodia about how we can take what kind of sometimes are these very dry, high-level indicators and use these to actually inform programmatic strategies and use them to help national strategies come together and actually start addressing some of these problems. I do think it's important, though, as we kind of sit in this JMP area where we're this time of the JMP, where we are looking at these massive numbers all the time, 90% of this, 80% of that, 60% of this, that all of these numbers, we can go behind them. These are actual schools. These are actual school children, and we need to remember that. As Aisha was saying, what's the story behind that? What's the actual drivers? What's the people that are connected to some of these numbers? And so we have a really interesting opportunity here today. I think one thing we haven't touched on is when I remember kind of from day one in School WASH, it was kind of this orphan priority. It kind of just floated out there in the middle. We didn't know if it was part of the Ministry of Water, if it was part of the Ministry of Education, if it was part of the Ministry of Health. And the answer kind of ended up being all of them. And so I want to introduce briefly a couple of participants we have today from Ghana that luckily for us represent this triumvirate of institutions. So we have Charlotte Aqua Adeje, I think I'm saying that correctly, I hope so, from the Ministry of Sanitation and Water Resources. Dorothy Opuku Adje from the Ghana Health Services, and Ellen Jechi from the Ghana Education Services. So I want to give them an opportunity to kind of reflect on the state of School WASH in Ghana, how this is done, the same way these numbers are actual students. When we talk about countries, these are actual people that are designing and implementing programs. So let's hear from them for a brief moment, if that's.
Thank you very much for this opportunity. Like you see, we have Ghana Education Service. I work for Ministry of Sanitation and Water Resources, and she's from Health, but we have one common objective: to provide facilities for our children in schools, to promote their public health, and then also to keep them safe at school. So Ellen will wake up every morning and call me, "Charlotte, my school children, they are toilets." And when he mentioned you can't do only the hardware where you just go and provide a facility and go, we need to do a lot of sensitization, do a lot of education for the children, especially on hand hygiene and health. So we have our colleagues from Health. We also integrate menstrual hygiene management into our interventions. So we work as a team, and we also collaborate with the NGOs and civil societies groups within the various communities to work. So under the Ghana Sanitation and Water Projects for Ministry of Sanitation and Water Resources, it's funded by the World Bank. We have a component that provides gender inclusive and disability friendly facilities for schools. So for national level, what we did was to talk to Ghana Institute of Engineers, They are in charge of structural engineering in the country to come up with a design, of course, with support from UNICEF, to have a standard design for school facilities that look at disability, child, and then also the menstrual hygiene management for girls. So with our design, we have our rails, the ramps, whatever kind of disability child you might have in the school should be able to access the facility. So it's not customized for only maybe a child, a deaf, a deaf, blind, but for any child, even autistic child should be able to use the facility. We do have changing rooms also for girls, so they will have to change. And we are even advocating providing free sanitary pads in these rooms, so the girls do not have to go and talk to someone before they get access to these things. And within our project, we buy a lot of these sanitary products. Unfortunately, in our rural areas, we have to do a lot with the reusable sanitary pad. The global communities supported us with the sanitary pad for the girls in those areas. And then also the operation and maintenance aspect, we got engaged with the civil society to help us with that, and some religious organizations. So we designed facility management plans. We have to put school clubs, girls clubs, and all those to be able to keep them ownership of the facilities, and then use innovative approaches, what is available within their context, to be able to manage facilities. Of course, government puts money for facilities, but we cannot get support from government to solve the nitty-gritty challenges that we'll have at the schools. So there's at the school level, the PA or the PTA, the Parent Teachers Association, has to take some part of responsibility of managing the facility. Yet, of course, if your child is at home, you are supposed to provide for them at the household level. But when it comes to school, they belong to government, but we still need their support to do that. And then we have Madam Ellen's unit, the SHEP School Health Education Program. They also have a lot of educational tools. They have come up with UNICEF collaboration. They have come up with a lot of flip chart for education, posters, jingles, audios, and all that, that the children, the school health clubs can use to educate themselves and their peers. So they reduce the O&M cost at the schools. The children will go and open the tap and leave it, and their water bills are going up. They remove 100 years of tissue when they go to urinate. So we do all these engagements to make sure that the children also reduce the wastage at the school, and then the school themselves will be able to manage their facilities. We have been able to provide for over 500,000 people within the Greater Accra, and we have received additional funding, and we are targeting doing more in the second largest city, which is Ashanti region in Ghana, and then advocating more for menstrual hygiene, especially for girls with disability. We always leave them behind. And if you are not leaving anyone behind, then of course we have to have sanitary products that girls with disability can equally use, and they'll be comfortable to go to school when they are menstruating. Thank you very much.
Okay, well, thank you all for coming. We'll see you in 2024 when there's a new version of the school wash cranked out. So enjoy the rest of the conference. Our colleagues from Ghana will be here to discuss further. So thanks a lot.
You're my hero.
Thank you, Christy. Thank you, Ellen, Charlotte. Bye.